Welcome to AZ Medical Videos. Please take your time to click the like button below or subscribe to our channel. Also, don't be afraid to comment and tell us your thoughts, opinions, requests, or criticisms. Today we're going to discuss a 12-lead EKG and some clinical applications pertaining to EKGs. This video is assuming you already have the basic understanding of the waves represented on an EKG. Now we will look toward applying those concepts as well as viewing a test question related to the topic. So in a 12-lead EKG series, you have 3 standard limb leads, 3 augmented limb leads, and 6 precordial chest leads. Let's do a quick review. So during a wave of depolarization, a positive charge will be traveling from a negative electrode to a positive electrode. This is called a positive complex and will show an upright wave. However, if the positive depolarization wave is moving from a positive to a negative, then the opposite is true and you will notice a downward or upside down wave. So let's move over here and take a look at what we are likely to see on an EKG. So you have the P wave indicating atrial depolarization, QRS complex showing ventricular depolarization, and T wave showing the heart's ventricular repolarization. Here I have drawn your standard lead 2 complex as well as an upside down complex, usually indicative of lead AVR. We will get to that in a moment. So let's start out learning an important little diagram that I encourage all viewers to learn how to draw. So let's say you have a negative electrode here connected with a positive electrode on this side. This is indicative of lead 1. Now let's say you have a negative electrode extending from the same starting point but meeting a positive electrode down here. That is a standard lead 2. For this last one, I actually made a mistake in the arrow. Should be running from that negative electrode in the top right corner toward the positive electrode at the bottom. You will see a corrected version of that in a second. So here are how these 3 standard leads are correlated with the heart. I want you to think about each positive electrode as an eyeball or camera looking in that direction to the heart. Now let's correlate this to real life. You have your patient over here. And as we said over there, to connect lead 1, place a negative electrode on the right arm and a positive electrode on the left. To connect lead 2, place another negative electrode on the right arm and this time connect a positive electrode on the left leg. Lead 3 negative electrode will be placed on the left arm and the current will be running to the positive electrode on the patient's left leg. So that's enough about standard limb leads. Let's talk about augmented leads. So as we mentioned before, we have 3 augmented limb leads, AVL, AVR, and AVF. Each have a positive and negative lead. AVL's positive lead is situated on the left arm as the other 2 leads are placed on the other 2 limbs. Notice throughout this video we will not be placing an electrode on the right leg. AVR's positive electrode will be placed on the right arm as the negatives will be put on the other limbs, and AVF, think F for foot, will have the positive placed on the left leg. So what's the point of all these dang leads? Well, let's take a look at this. These are the angles in which the leads are evaluating the activity of the heart. To get a complete understanding and accurate diagnosis, 12 leads become necessary. So let's start here at 0 degrees. As we've seen before, this is the angle of lead 1. Down here at 60 degrees, we will see lead 2, 120 degrees for lead 3, negative 150 degrees for AVR, negative 30 degrees for AVL, and positive 90 degrees for AVF. These 6 leads cover the entire frontal plane of the heart. Now let's move to the horizontal plane of the heart covered by the precordial chest leads. I'll start by drawing a thoracic cage. The chest leads are arranged from V1 to V6. It may be hard to see, but V1 is placed at the fourth intercostal space on the right sternal border. V2 is placed at the same level on the opposite side. V4 is placed in the fifth intercostal space at the mid-clavicular line. V3 is placed between V2 and 4. V5 is horizontal to V4 at the anterior axillary line, and finally V6 also at the fifth intercostal level, but at the mid-axillary line. So what exactly are these electrodes looking at? Well, here is your heart. The right ventricle and left ventricle divided by the interventricular septum. V1 and 2 evaluate the activity in that interventricular septum. Hard to depict here, but V3 and V4 view this anterior surface of the heart, and V5 and 6 look at the lateral wall of the heart. If you think about it, lead 1 and AVL also contribute to this side of the heart. It is also very important to note that lead 2, lead 3, and AVF look at the inferior wall. So take a second to read and answer this question stem. I'll post the answer in the description below. Thank you.